Hello and welcome to the France 24 interview. Our guest today in Washington is Dr. Anthony Fauci, the immunologist known around the world as America's doctor. Dr. Fauci, you are the director of the National Institute of Allergy and Infectious Diseases and chief medical advisor to the White House. Your time is extremely precious, so thank you very much for being with us.
Good to be with you. Thank you.
First, can you tell us what this last year has been like for you and how do you keep up with this pandemic frantic pace?
Well, this has been a most unusual year in all of my experience. I have been the director of the National Institute of Allergy and Infectious Diseases, and I have dealt over the last 37 years with HIV/AIDS, with pandemic flu, with Zika, with Ebola, with a variety of illnesses. This is very unique. So it's been a very difficult year. We've had a lot of suffering, a lot of death, a lot of economic disruption. But also in the United States, it has been a year that has been frustrating because there's been a lot of political divisiveness, which has made it very difficult to respond in a completely adequate way, driven only by public health considerations. A lot of the issues of the outbreak have taken on a political connotation, like a reluctance to wear masks because of a political ideology or a reluctance to avoid congregate settings. So it has been very difficult. The science has been very good because we've been able to develop vaccines in record time, but we still are being challenged because even now, a year and 3 months later, we're still having what looks like surging of cases in certain parts of the country, similar to what you're seeing in Europe.
You just talked about political connotation. Donald Trump recently said on Fox News that he didn't listen to you too much and that he was doing the opposite of what you were saying. How did you adapt to that and did it undermine your work?
Well, it was not easy, I would say. I tried and I continue after to try our best to get the truth to the American people and to the rest of the world. It's unfortunate that we had this political divisiveness in our country. I think it made it much more difficult to adequately respond to the outbreak when you have that kind of divisiveness in our country.
When you were working for former President Trump, you and your family have been harassed. Do you still receive threats?
Yes, I still do receive threats. And that's because even now, even though the administration has changed, there are millions and millions and millions of people who are still very, very much in favor of Trump. And whenever one says something that disagrees with him, you wind up getting threats. And for that reason, I still have to have federal agents protecting me.
You're now working for the Biden administration. What has been the biggest difference so far?
Well, the biggest difference is that it's very clear that everything we do has a basis in science. Science drives what we do. We make decisions based on evidence and data, and we do things based on our knowledge of what the science is. So it's a very science-oriented administration. And we are allowed to speak freely and openly about anything that we feel is important for the American public and for the rest of the world to know.
President Joe Biden announced a few days ago that all US adults will be eligible for COVID-19 vaccines by April 19. It's around 2 weeks ahead of schedule. How do you explain the acceleration of the vaccination campaign in the United States?
That's explainable by the fact that we have accelerated the production and the implementation of vaccines considerably. We have contractual relationships with Moderna, with Pfizer, with J&J, and we've been able to push on the production and the implementation of it. So the increase in our ability to implement this and the fact that we are now averaging vaccinating between 3 and 4 million people per day, which is considerably higher than the 1 million that we were doing before.
How did the Biden administration help accelerate the production of vaccines?
They did it a number of ways. They invoked one of the laws that we have that allow companies allow us to get companies to produce things at a higher rate to get some of the ingredients for the vaccines that we needed, as well as signing additional contracts to get them to be able to do more. For example, about a month or so ago, we were able to get Moderna and Pfizer to agree to make 100 million doses more than they had originally promised.
Former President Donald Trump likes to remind people that he laid the groundwork for the vaccinations. It seems that Moderna started to work on its vaccine before Operation Warp Speed. So, does the former administration deserve the credit it claims?
I think the former administration does deserve credit for Operation Warp Speed. I mean, a lot of things were done before Warp Speed, but I think the formation of Operation Warp Speed was a very important, positive thing. And I think that the former administration deserves a lot of credit for doing that.
So once we get the vaccine, how long are we protected for?
We know from recent studies that came out literally a few days ago that the protection of the vaccine lasts at least 6 months, but very likely considerably longer than that. We will continue to follow the progress of the people who've been vaccinated to determine exactly how long the protective effect lasts. But we do know from solid studies that it is at least 6 months and likely considerably longer than that.
Given the success so far of the vaccination campaign, do you feel that the US will be out of this crisis anytime soon?
Well, I hope so. One of the things that we're concerned about is that there are these variants that have the capability of spreading more efficiently than the original virus. We have a variant in the United States that you also have in France, and Europe has it. It's the B117 that originated in the UK, that it is making it much more difficult to control the outbreak because we know that the virus spreads more efficiently from person to person. So it's kind of a struggle between the vaccine and the virus. And hopefully, because we're vaccinating 3 to 4 million people per day, that within a very reasonable period of time, we will actually have this under control.
Let's talk about the rest of the world. The European Union is lagging behind the US in terms of vaccinations. Some have qualified the situation as a fiasco. What advice will you give to European policymakers?
Well, I think the European policymakers should try to get the contractual relationships. They already have a considerable relationship with AstraZeneca. There's been some controversy with that product regarding the possibility or the reality of there being adverse events like blood clotting. I think the European Medicines Agency should clarify and make recommendations as to what they think should be done about that. What I've heard, and I've just heard this through the news media, that they believe that there is an adverse event risk, but that the benefit of the vaccine is much greater than the risk. So this is what they're saying. And that being the case, then I think they should base their policy on that.
We just learned today that 71% of French people don't trust this vaccine, AstraZeneca. What do you want to underline? What do you want to tell these people?
I think that they should listen to their regulatory authorities. It's not for me to tell the French people what to do. I think the French authorities are very competent to be able to advise the French people of what to do.
What will you tell to people who are still worried about getting the vaccine in the US and in the rest of the world?
We encourage people very strongly to get vaccinated because these vaccines are highly effective. We know that. So we encourage people both for their own safety, for the safety of their family, and ultimately for the safety of their community and their country to get vaccinated, because the larger proportion of people that get vaccinated, the more quickly you will get the epidemic and the pandemic under control.
Amnesty International has recently accused the richest countries of monopolizing the vaccine supplies. Do you think that the Biden administration should lift the intellectual property protections on COVID-19 vaccines to increase access to it?
The Biden administration has done some important things. One of the first things they did, and they asked me to do that the day of his inauguration, I got on a telephone conference with the executive committee of the WHO, and I announced that we are rejoining WHO, something that the Trump administration had pulled us out of, that we were going to join COVAX, which is a consortium of organizations and countries that will try and hopefully succeed in getting doses of vaccine to low and middle income countries. And we made it clear that when we get our people fully vaccinated, that if we have surplus vaccine, we will make it available to those countries that need it.
If the slow rollout of vaccines persists in the developing countries, how will it impact the rest of the world, especially given the threats of new variants?
This is a global pandemic and it requires a global response. And that's the reason why it's very important to make sure that the rest of the world has the opportunity to get vaccinated, because even if you suppress successfully the virus in the European Union, in the UK, in the United States, as long as there's a lot of virus activity somewhere in the world, there is always a threat of variants emerging and re-threatening those areas that felt that they were actually protected.
Do you think more can be done to help the poorest countries and countries in crisis?
Yes, I think that we need to make sure that COVAX is successful in getting resources, the same way that the United States has pledged or given $4 billion to COVAX. I think that the wealthy countries of the world should contribute in order to vaccines to the low and middle income countries.
When do you think the world will go back to normal?
That's very difficult to project accurately. I think it's going to be a combination of countries continuing to abide by the public health measures to get this level of virus low, as well as the success of the vaccine program.
So what do you see yourself doing once we're over with this pandemic?
Myself, I think when this pandemic is over, we have a lot of other public health challenges. We want to end the AIDS pandemic, which is something I've been working on for 40 years. And there are also a number of other diseases, pandemic influenza, malaria, tuberculosis. There are a lot of things we need to do once we finish this and put this behind us.
How do you find the time and the energy to do all of that?
I just find it. That's it. That's what I do. That's my commitment to my life.
Thank you so much, Dr. Fauci, for being with us. Thank you for watching the interview on France 24. Stay tuned for more news.